Good afternoon, everyone that's joining us for the Lucent IPL training webinar. I am just giving it a couple minutes. We're right on time with starting and just making sure everybody can log on before we start. So just giving it a little time before we start, and then giving you instructions of how, if you wish to ask questions during this webinar, you can do so. So just where I can see the numbers going in of people signing on. So I just want to give everybody another minute before we're going to start. All right, well, I think we're gonna start the presentation. So this is for the Lucent IPL. If you have questions while we're doing this, let me just see if I can advance my slides here now, or that isn't going to help me very much, is it? What's going on? Why am I losing? There we go. If you have a question, there's a Q&A box on for the Zoom meeting that you can ask questions, and we're going to answer them sort of in real time. If you're asking them when we're in a certain part of the presentation, that's where we will stop and we will answer the question. My name is Teresa Maloney, and I'm the Senior Clinical Trainer with Clarion Medical Technologies. I've worked with Clarion, going on this July will be 20 years. And I love the technology as a company that we train on for our customers. And one of these is this LUVO IPL, which we're going to go into in detail. With me, you can see I have on the screen is Sarah Jane Fitzpatrick. She's a fellow clinical trainer and our clinical manager, and she's here to help me along with this presentation and, of course, answer any questions that I can't answer, and we're going to do this together as a team. One of the things that when you registered, you got the resources of the Darwin Parameter Book. If you did not receive it or do not have it, there will be a link in the chat box that you can download it if you want to use that to follow along. One more thing I would like to mention with our partner, Brianna Gibson. She is our marketing person that just absolutely brands our PowerPoints to make them look amazing, our LUVO product line, and just gives it, like I like to say, the kiss of marketing to make it look really professional and great. So thank you for all your hard work on that, and we'll get started. So, I mean, we're talking today about the LUVO IPL, but in our LUVO family, we have different technologies that some you could put on one platform where you have 5 handpieces, and then we have other ones that are standalone. But the Darwin system, because you've been given the Darwin parameter book, it has 5 handpieces to do treatments. You can get the Bear 808, which is a hair removal device that stands on its own. We have Cool Form to freeze fat. We have the Bella, which we will be talking about today when we're talking about adding in to enhance your LUVO IPL treatments. So there's a whole family there of different LUVO devices that can be used. So this is what we want you to meet today, which is the Lucent IPL, and talk about the differences of what this can do to enhance your practice. I have worked with Luminous M22 for 20 years, and I was the Cyton BBL trainer for 8. So I make comparisons with that. I think technology is great. I think the M22 IPL is great. I think the BBL technology is great, but what differentiates us from that and to bring those results to your clients and patients? So key terms that I want you to understand is I always like to just go over this. Some people go, I don't quite get how this works. This is just an overview that I want to give you before we get into the pictures and start discussing the results that we can get with the LUVO IPL. And one of them is wavelength. And so what I want to discuss here is you're going to get 7 filters on your Lucent IPL that start at 430 and go all the way up to 755. In that, the higher the number, the deeper you're going to penetrate into the skin. And I think that's important to note that. So, I mean, we're looking at pigment, we're looking at vascularities. They sit at different depths in our skin. So we want the right filter to target what we want to go after. Fluence is energy, it's heat. Some people say fluence, some people say joules. It's heat. How much heat do you want to put in the tissue to destroy a target but not hurt the skin? And everything we do with our heat, we put it in a pulse duration that is called milliseconds. Milliseconds is 1,000th of a second, so it's going in quite fast. The higher our milliseconds are, the gentler we're putting in our energy. The lower our milliseconds are, the faster and more aggressive we're putting in our energy. And pulse duration influence is 100% depending not only on the condition we're going after, but the skin type we're treating. When you're treating darker skin types, you will be putting the energy in gentler, slower. When you're treating lighter skin types, you will be putting the energy in more aggressively and faster. And the whole point, if fluence and pulse duration hold hands and are in sync with each other, you cause thermal relaxation time, which is the time scientifically measured to heat up target and not to destroy skin. So that's our sole purpose. But all the parameters that you're reading or that you see, it is all based on what someone's skin type is. The hertz is speed. This will fire every second. It can stay with you. If you're a very experienced user, it can stay with you throughout the treatment and make it go fast. Or if you're inexperienced, you just don't push the trigger. You go at your own speed. But the speed is there for the inexperienced and the experienced. The cooling is set in Celsius and it's set by the filter that you put in. So you're looking anywhere from 14, 16, sometimes 18 degrees. Whatever filter you put on is the standard of where they feel the cooling should be to protect the skin as you deliver the energy. So how do we age? Well, intrinsic is natural. So thank your mom and dad for what they gave you. Extrinsic is where you have control of what happens. Smoking, sun, pollution. These are all things that can age the skin. Starting at the age of 20, which is unfortunate, we start losing our natural collagen by 1 to 2% a year. And we know in the clinics that we work in, when we start seeing women that want to do something for their skin and they want to make it look better, they tend to already be sitting in their late 20s and their 30s and so on and going up. And I always compare it to like a collagen bank. 1 to 2% has been coming out from the age of 20. Let's make a deposit. Let's deposit into your collagen bank. There's only 2 ways I can form collagen. I can inject it in the form of hyaluronic acid, or I can stimulate your own collagen by making your body heal the energy that I've put in. So this is just a great way to create collagen. You will get rid of the targets that you're going after, but you will also stimulate collagen. So what is a photofacial? Well, it's a skin rejuvenation treatment using light pulses to target dermal pigmentation, as well as vascular concerns. But like I said, it will stimulate collagen, enhancing skin tone and texture. And when you do a little bit of heat in there too, you're also going to shrink the elastin. And one thing, as we get older, we start coming enemies with gravity and we start falling. So you will get a little bit of that tightening by targeting the heat into the elastin. So the Lucent IPL advantage here is that you have accurate cutoff filterings. You have 7 of them, which we're going to go over in the next slide. You have square wave pulse technology for safe treatment. What this means is that your sapphire on the handpiece does not peak at different energies throughout the sapphire. It is even all the way throughout. Then you have a toning pulse technology, and this is what sets us apart from other IPLs out there. It is for reducing unnecessary thermal damage and targeting what you can't see. Every time you look at someone's face and you see, the window that it's dirty, vascular, or pigment, and you want to clean it, you have to understand that it's down there too, what we can't see, what I sort of call the iceberg effect. And that's where we want to take that toning pulse to target that, what we can't see, and then come over top with a filter that is more superficial to target what we do see. And you can do multiple treatment modes for customized treatment and use many different filters as you're doing treatments by what you're diagnosing on your client and your patient. So these are the filters that we're looking at. You have a 430 filter that targets acne bacteria. It is, when it flashes, if you see the flash, it does flash blue. I always also advise anyone doing these treatments to let your patient know that they will see the light through their skin. It is not dangerous light, but they will see the reflection of the light. You have the 515, which targets superficial melanin. So we're looking at sun damage. We're looking at melasma. You have the 560 that targets rosacea. This is considered a gold standard wavelength when treating rosacea. You have the 585, which targets those deeper reds that we can't see. This is where I would use to go deeper into the dermis. Also, telangiectatic vessels. If you have those vessels within your flushing on your cheeks, the 585 can target those really well. And remember, 585 is also the same wavelength as a pulse dye laser. So it, again, is very attracted to vascularities in the skin. You have the 640, which targets dermal melasma, goes for what's deeper. The 700 and 755 is for hair removal. Some people love using IPL as a hair removal device, and it does a great job with hair removal. A lot of times, though, in options, when people are bringing in IPL, they already have a hair removal device, like a laser, like a Bare 808 in their practice. But just to let you know, with hair removal here, it marries well with a laser. If you're doing hair removal and you get to the point that that hair is just fine and light, and the laser's like, I've done my job, my 60 to 95%, sometimes the IPL, if there's any color left in that hair, can grab it and just give you a little bit more percentage in the loss of what you're doing there. So, discussing the filters is one thing, pulse duration and fluence, but how are we sending this energy in? So there's different ways that we can put our fluence and our pulse duration into the skin. The first one is in a single pulse. And I always refer to this sort of as my sledgehammer. This is the one where I'm aggressively going to target the skin, still being safe with what I'm doing. But there's some times where you need that sledgehammer. You need that single pulse to get what you want to target. Then you have a double pulse. And what the double pulse does is it divides your energy. So if I was going in, say, at 20 joules in a single pulse, if I moved that over to a double pulse, it would divide my energy. I don't know if you guys can see my cursor, but 10 would go in here and 10 would go into this side. And down at the bottom where they attach, you would get a 20 millisecond delay. So it's on, off, on. And just in that millisecond, you are delivering the energy gentler. And where would I do that? I would do that if I was treating someone that was quite vascular. The triple pulse, again, even gentler. You're dividing it now into 3. This is also a great pulse to use. We use this also with optometrists and ophthalmologists for the treatment of dry eye. And again, if someone was extremely vascular, I might start in a triple pulse just to bring that vascularity down before I move to a double or a single. Then we have something unique on this system, and that is the Lucent toning pulse. This is delivering up to 10 joules, millijoules, 1 subjoule at a time, up to 10. So it's almost like skipping a rock on water of how this energy enters the skin. It suppresses heat, and this is where we're using that toning pulse for that iceberg effect. Go where I can't see with the toning pulse, then come over top with my double, my single, and treat what I can see. So you're sort of bookending your concerns for your client patient if you use this in combination. So just to give you the definition of it, affects a various pigmented lesion on each layer from epidermal to dermis. This is what the toning pulse does. A single pulse of constant energy is divided into a number of subpulses up to 10. It's suppression of unnecessary heat damage of surrounding tissue. I have used this time and time again with the treatment of rosacea. And one of the things is when you're looking at rosacea, you see that inflammation with it, and it just looks tender and raw. After using a toning pulse on it, we do have redness. It just looks like a calm redness. Less pain and excellent treatment effect. And of course, this is something you could use as maintenance treatments with little downtime using a toning pulse. So there's just so many options when you have the toning pulse available. So as a clinical team with Clarion, we're always trying to find the best combos and figure it out for you so that when you purchase the technology, you're up and running and you're able to achieve excellent results for the people that you're treating. So our best combinations of what we're doing is 640 and 515 for our dermal pigmentation and our epidermal pigment. Our 585 and 560, we've teamed them together to target our vascular concerns, whether they're deep or superficial. This is a good team. So the larger the spot size, the deeper the penetration. What I want to show here is you have your nice big sapphire on your handpiece. That really is what you should be using to do your entire treatment. But there is a 12 by 12 adapter. So it's the little square that's on there that you can put on the big sapphire if you want to go in and target individual lesions. So if you're using the large adapter, and let's say your energy was at 10, and you wanted to put the small adapter on, you need to increase your joules by 2 to 3 because the energy is now not the same. So what I want to highlight here is that when you put the small adapter on, please adjust your energy up by 2 so that you're going to get that effect with it. But overall, the entire face, if you're treating, you should be treating it with the large sapphire.
Teresa, we just have a question that came in. Can you just go back to the previous slide? The best combination treatments there. The question is one of these in a toning pulse?
Yes, if I'm doing these in combination, the 640 would be the toning pulse, the 515 would be the one where I would be more aggressive in a single or a double, and with the 585, I'd be using that in a toning, and then the 560 would be in my single or my double.
Thanks.
So here I just want to make it very clear that when we're using an IPL, and IPL loves color, and there's things that we do not want to target with an IPL. And what that would be is that would be if our lips had blushing on them or if we had microbladed eyebrows. Those are considered tattoos. When we do tattoo removal, we're firing at 1/100000th and 1/1000000000th of a second to remove a tattoo. This is firing in milliseconds, so you would melt your target. So it is important that we're aware of scatter. Scatter when light, energy, lasers, IPL, when they go into the tissue, they scatter. They're not considered a straight line. So you should be 1 finger length away from something you do not want to target when you are using this. With a laser, I recommend 2 fingers because I don't want to mess with somebody's artwork. I don't want to mess with somebody's eyebrows. So if you mark it out, you're safe. You're not going to cause an effect or an adverse event if you're doing that. Reflection is the light reflects off the skin. So if you have a lot of shiny surfaces in the room, that energy can bounce back at you. Absorption, self-explanatory. I want the energy to absorb into target, and transmission is that it goes by target. So in that case, when you're on bony areas, they can feel it a little bit more when you're on those areas. But scatter is the big one here that we really want to pay attention to. So if my eyebrows are microbladed, I'm going to put my finger here and I'm going to make my mark across, and I'm going to stay on that side of the borderline so that I don't wreck anybody's eyebrows.
Sorry to interrupt, Teresa. We just had another question come in. So it's following the question of the toning pulse that we had earlier. So the question is, does it matter which filter you do first when laying the treatments?
Very good question. It does matter. You always want to go deep to superficial. Always start at the bottom and work your way up. So it's almost like I want you to look at the toning pulse like you're taking care of the box spring. And then your therapeutic, your single or your double, is taking care of the mattress. And then the sheets look amazing. That's sort of how I look at it. But I prefer everybody starts with the deeper filters and then goes to the superficial. Great question. So Fitzpatrick's skin typing. Now, we have people from here from the United States. We have people on this webinar from Canada. And some of this we might do a little bit different. But overall, what I'm trying to put together here is just where do they sort of fall in it, and what people that you're seeing the most of will set your parameters that you're doing. So when we look at the Fitzpatrick typing chart, pretty much here in Canada, we start at a skin type 2, the blonde, the blue-eyed, really, really light skin, and the easiest person to treat because their melanocyte, which gives them their color, is not a really big target. So it's very easy. We can be more aggressive on that skin type. You're looking at your Irish, Scottish, English, Norwegian. These are people that tend to fall in that skin type 2. I don't really go by people's hair color because people color their hair, tend to go by eye color. The lighter the color, more into that too. Skin type 3, now we're looking at that deeper blue, green, brown, hazel eye, Mediterranean, Middle Eastern, here French Canadian, Italian, Latino, not people of color, but look like they have a little bit of cream in their coffee. These are the ones that fall into a 3. Skin type 4 is East Asian, Chinese, Japanese, Taiwanese. Our Asian skin types are a skin type 4. And as light as they can represent, they still have the larger melanocyte. So we still have to respect that that melanocyte is sitting there, and IPL loves color and it will take it. So when you look at someone who's Caucasian and you look at somebody who's Black, we all have the same amount of melanocytes, except in dark skin, they're larger. So the target is easier to go after. So from skin type, 1 to 4 is where we say it's really safe to treat with IPL. When you get up into skin type 5, where you're dealing with an Indian descent, East Indian, Filipino, First Nations, this is a Mexican, this is where it gets scarier treating that skin type because it's competing with the melanocyte. And skin type 6 is absolutely no, 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 because you would burn them. So it's just too much of a risk. There's other technologies out there that do better for that. But what is your genetic code? Where do your parents come from? What happens when you burn yourself? Do you make a pink mark or a brown mark? A skin type 1, 2, it'll burn, it goes pink, 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 gone. Skin type 3 and up, it goes pink and then it hyperpigments and slowly goes back. So that's sort of a tell of questions you can ask your patients, clients, to help you determine what filter and parameters you should start with.
Teresa, we've had a couple more questions come in.
Sure.
Those that have asked questions, I will ask your questions when we get to this session on rosacea. But one of the questions that came in with Fitzpatrick's skin type is someone is a 2 in the winter, but a 3 in the summer. How would you treat?
Well, if they're and a 2 to a 3 can be that exactly. Like I am right now a 2, and you get me in September, I'm a 3, and you have to follow that. If I'm a 3 at that time, then you have to treat me as a 3. But one of the things I want to make very clear is we don't negotiate with a tan. If someone has a fresh tan, we don't treat them. We don't lower our parameters because they have a tan. For a skin type 1, 2, you want to wait 4 weeks from a fresh tan. And for a skin type 3, 4, you want to wait 6 weeks from a tan, because the melanocyte is now activated. So what's the IPL going to see over everything? And for 20 years, I have said that don't negotiate, you will lose. And this is where we want to be very careful. But yes, if you're seeing me after the summer, you might want to bump me to a 3 for that first treatment till my melanocyte comes back, but just don't treat me when I have a fresh tan.
Perfect. Thanks, Teresa. And one more. I will get to the other 2 questions I'm not going to ask right now, but can the 755 be used for collagen stimulation?
Well, anytime you put energy into the skin, you can use it for collagen stimulation. You can put that on, I think it goes to a triple pulse. However, doing a toning pulse with the 640 would probably give you more of that collagen stimulation. But if you're looking at it is that you want to go deeper, you want to go to the 755, yes, you could do it just for that if you wanted to.
Thank you.
Okay, so here is our first poll. If you look at A, B, and C, which one of these pigmented lesions are easy to treat with IPL? If everybody wants to make a choice and click on that, I'll give everybody a few seconds, and then we'll look at what the answer is.
If you're on your computer, you might just need to move the poll around so that you can see the
Oh, is
image
it
feed.
covering it? Okay,
Yeah,
I'm
it comes up.
sorry.
That's okay.
I can't move it. Maybe here? No, it's not letting me move it. Sorry. No, it's right in front of it. Can I reduce it so everybody can see the picture? Do it that way?
I think the panelists, or sorry, the attendees should be able to move it around.
Now I've lost. Do you see it, SJ, on yours though?
I do see it, yes.
Okay, so I'm gonna let you sort of just tell me there.
Oh, it says we lost the poll. Bree, could you
Oh,
put that back up?
there we go. Okay. So
All
we
right.
have A, we have B, and we have C. This is good. Okay. So let's take a look now at these lesions. Just gonna get my computer now. The poll sort of, there we go. So A is actinic keratosis. AKs are precancerous lesions caused by long-term sun exposure, thick, scaly, and crusty to the touch. Seborrheic keratosis, common non-cancerous skin condition. Lesions look waxy and scaly and slightly raised. People tend to get more of them as they get older. And then you have C, lentigines, benign lesions that occur on the sun-exposed areas of the face, hands, and body. They are flat with discrete borders, dark in color, and have a regular shape. So the answer for this was C. To get the best results for pigmented lesions, it's going to be your lentigo, which would be 1, or lentigines, which is many. Now I want to talk about the other ones that people answered. With AKs, you can potentially lighten them with an IPL, but they are now formed as a lesion. They have borders, so they're not something you would completely be able to remove. And seborrheic keratosis, unfortunately, they need liquid nitrogen, they need laser, they need excision, and same with actinic keratosis. They need more than just what IPL could do on its own. However, if you're using a product called Levulon, which can go after AKs and give a more aggressive treatment and activate the Levulon with it, which is a drug that you can put on the face and targets the sun damage, that would be the best. But overall, the best response for these 3 pigmented lesions is going to be the lentiginase. Which image represents melasma? A or B? All right, so let's see our results. B, absolutely. That is 100% correct. So let's take a look at what we're looking at here. My slides don't want to go ahead after this. They're like, no. There we go. So sun damage, photoaging is damage caused by exposure to the sun. It appears mottled and freckled and does not change color with temperature changes. Melasma causes symmetrical brown, blue-gray, or light brown patches on the face and neck. It darkens in hotter weather and often is associated with female hormones, women taking birth control or hormone replacement therapy during menopause. So melasma looks like you put your bronzer on wrong, is really what we're looking at when we're doing it. And sun damage looks more mottled and freckled. When we're treating these, this is where we're looking at how do we treat them, which is very different. If I'm treating someone with sun damage, one of the things that I'm going to do is I'm going to set you up for a series of treatment, whether I'm going to do 3 to 5, but my goal is to remove this. This is sort of what I like to say, cleaning the window and getting rid of as much as I can that is reflecting through the epidermis. When we look at melasma, melasma's response to heat is it gets very angry and it doesn't like it. So I can't do a series of treatments with IPL to correct the melasma. I get one shot to go in there. I want to darken it. I want to upset it. I want to disrupt it so that the body comes in and I get that collagen stimulation to help exfoliate and remove some of it. You can improve melasma anywhere from 10% to 95% in one treatment, but everyone's melasma is their own and it's unpredictable of how much improvement you're going to get with one treatment, but all you can do is try. The thing that we would never recommend is to continue going back and hitting it with IPL. What you want to do is you want to treat it, see how much you resolve of it, and then move them on to other technologies for further improvement. For example, which we're going to show in our skincare part, Bella MD, doing a facial on it, keeping it down, suppressing it, wearing sunscreen. These are things that we will go through. It will manifest again, whether it's in 6 months, whether it's in 9 months, that you can go back to another IPL treatment. You just don't want to do them in a series when you're dealing with melasma.
Teresa, we have 2 questions here. What filter would you use for AK and Levulon?
You can use for the Levulon, you could use the 430 filter, which is a blue U light. They actually make a big standalone one of a blue U, but you now have it on a filter so that you can activate it that way. I've also seen people activate it with the 560. One of the things I would remind you though, before, like if you let it sit for an hour before you're going to activate it, because you do want to let it sit, what I would recommend is wiping it off as much as you could before you put the gel on, because you're just going to do it like a photofacial. You're just going to use the parameters that would be under their skin type and do it as a photofacial. But if you leave it on there, the gel will run off. So just make sure you've wiped it before you do that, and then you've activated it.
Thank you. And there's another question. What if the lesion looks like an AK, but does not have a different texture and it's not raised? Are they always precancerous in nature?
Yeah, I mean, it's just a term they use. It's precancerous, meaning it has the potential to turn into a basal cell or a squamous cell. It doesn't mean, or a malignant melanoma, but it doesn't mean that that is what's going to happen. That's just what the lesion is called, precancerous. If you're removing something and there was a cancer there, let's say you went after something and targeted something, and you get away, oh, I removed something, now they're not going to know. When you do an IPL treatment and you bring things to the surface, something that was brewing beneath the surface might come forward, and that you catch it actually ahead of time. One of the biggest things of something, if someone has a basal cell, is if they say to you, you know, I have this lesion on my face and it heals and then it bleeds. Every time I just wipe it, it'll bleed and then it'll heal. That tends to be a sign that that could be something that you want to have your dermatologist or physician look at, because something shouldn't keep bleeding and healing, bleeding and healing. It resolves, or there's maybe a deeper issue there.
And we have two more questions. For those that are asking questions around vascularity, we will get to that section and then I will ask your questions. So the one question here, Teresa, I'm going to ask it as a two-parter. For melasma, how frequently should we treat our one shot and done? And the other question is melasma, treat only once. Can you elaborate?
When you're treating melasma, like I said, it's one and done is what you're doing, sort of at that time, one and done. So you treat it, and then what you do is keep it as controlled as possible with other things that are not heat related, that, you know, for skin care, sun protection, all those things. Because it is hormonally driven within their body, they're going to come back to you in 6 months, 5 months, 9 months, depending on how good they are with doing what they're doing on their end, or how their body is creating it, and going, I need another treatment. I can't cover it with makeup. And it's all about that expectation. Your chances are not going to make it completely go away, but you want to make it look better under their minerals that they're wearing. So that is the whole purpose of melasma. And I can tell you what the cure is for it. I can give it to you right here, right now, is full on menopause. I had severe melasma, and once I went through menopause, my melasma is completely gone. So all I did throughout my entire part of having it would try to control it the best I could with products, and then every once in a while making it very angry with an IPL.
Excellent. We've got a few more questions coming in. It's lovely. It's very active here. So, what filter? Oh, we answered that question. Sorry. Are filters 430 and 515 safe for skin type 4 and type 5?
No, no, not the 430. The 430, I wouldn't go beyond a skin type 3 with it. Again, remember too, the melanocyte is very superficial. So the number that you're using as well, the higher the number, the deeper you penetrate in the skin. So if you're using the 430 on a skin type 5, that would be an absolute, you could cause some serious problems there. But up to a skin type 3, safely use it. 515, I would use in toning mode on Asian skin types. I've seen it being done, and with really excellent results. I don't think I would use it as my sledgehammer if I'm using it on a skin type 4, and absolutely safe to use on a skin type 3.
Excellent. Thank you.
Okay. So polyderma or sun damage, I didn't put a poll here, but I just wanted to show you what you could be looking at when you're looking at polyderma or sun damage. So when you're looking at the polyderma, skin condition that consists of areas of hypo and hyperpigmentation, vascular, associated with sun damage. But some ingredients in perfume, like lavender and citrus oils, they can cause hypersensitivity to the UV light. So I always say, don't spray perfume. People come in here and here. Spray it more on your clothes or at the back of your neck if your hair covers it down, because it can cause more sensitivity. And sun damage is just sun damage. You've exposed it. And here's the thing, a lot of this sun damage happens when you're a kid or a teenager. And then as we get older and that collagen starts to deplete and that wall starts coming down of collagen, it goes here. Let me show you your youth of what happened And this is what we can target when you get older and remove that for you. The treatments would be pretty much the same of what filters I would choose. But again, if I was treating poikiloderma, if there was vascular, I'd be looking at my 585 and 560. And when I'm looking at pigment, I'm looking at my 640 and my 515. So I have all these different combos that I can use to target what I need to target. Oops, sorry. So I just wanted to put in here this, when I'm doing a 640 toning, this is what's going to come up when you put your filter in. You move to the toning pulse. I drop my milliseconds down to 10. And this is under a skin type 2. And my fluence is 9. And I do the toning pulse. If I'm doing it down on the neck, chest, all of that, this is the setting that you will see in the book is for the skin type 2. Then if I'm going to go into my 515, if you see here, we have a P1 and a P2 setting. The P1 is facial settings, and the P2 is for your neck and chest. The reason why the parameters drop down from 12 for the P1, which is for the face, and down to 10 when we get to the neck and chest is because we don't have the same healing properties. So we want to treat that gentler down in here. Now, do I make adjustments? Sure. If I'm at the P1 and I'm at 12, I might go to 13. What I'm trying to do is I'm trying to light up the pigment. I'm trying to make it go darker. The coffee ground look is what I'm looking for, like wet coffee grounds. So if I don't see it at 12, I would go to 13. Same with the neck and chest. If I start at 10, I might go to 11. But I find that this P1 and P2 are very well set to give you the best results.
Teresa, question, would we use P1 on the body, arms and legs?
No, not P1. You would use P2. P2 is the body settings. So if you want to treat the body, and remember, the farther you go down the body, the less forgiving it is, right? So if you're going to even go, like if you're going to do the legs and treat pigment, I might even go down to 9 and just test out the waters first and see before I start being too aggressive in that area. And here's some results that we have for a chest. So if you look here, quite red along in here and swelling, and it captured a lot of her pigment. Now, I've had people say to me, oh, but that's a bar mark. Like you've burnt, that is not a bar mark. A bar mark would be very defined rectangle. This is just capturing and you see the diffuse of it. So this is a great treatment. And one of the things I also recommend, which is something that you guys can do, is if you take white vinegar and you spray that after, if you put down some gauze and made the gauze wet with white vinegar, you very quickly draw out heat that you don't want to be there. If you feel, oh, I think I was a little over aggressive here, white vinegar is something that definitely helps bring out heat. Okay. It's antifungal, it's antibacterial. I grew up smelling like a pickle. My mom would put straight vinegar on my sunburns and it just soothes it and relieves it and draws out the heat. It's the same with an IPL treatment. If I was using it in an ablative situation, I dilute the vinegar. When I'm using it in a non-ablative situation, I don't have to dilute it. Here's hands. So this one here, sorry, let me go back for a second. I just want to show you this one. This one is done 640 toning, 515 P2 setting. This one is 515. And then I took the spot adapter, and if you see on your parameters, it says spot treat only. I put in the 430, and some of the pigmented spots I hit only with the little 12 by 12 square adapter for ones that I did not feel got dark enough. Now, when you're treating hands, there's this delayed effect. So don't adjust. If you treat one hand, you go, oh, I don't know if that got darker. Go treat the other hand first. Then you go back and look at the first hand. You get that sort of delayed reaction with the lentigine. So don't be overly aggressive that you don't think you're seeing it when you're treating at 10. And you can always go back and spot treat what you feel you can't see. So this is what I mean by lighting them up. This is the coffee ground effect. I was doing a training and Dana was, brought in her husband as one of our models. Thank you so much, Dana, for that. And we were totally treating faces, and I saw his hands and I said, can we just give it a shot? Let's treat it. And the result was absolutely phenomenal. So I'm sure Dana's really happy that her husband got this result. And again, thank you for being a model for us. This is a treatment done by one of our clinical trainers that she allowed us to share. Thank you so much, Nikki. She has a clinic in Penticton, BC. I'm assuming she did 640 toning and 515 single pulse, but I can't be sure. But I did put in that combination of 640, 515, because that's sort of how we are targeting pigment. Go deep, get after what we can't see, then come over top with the 515. But again, really great results from Nikki.
Teresa, just while you're pulling up the next picture, I have quite a lot of questions coming in. So I'm going to ask a couple and then we'll save some of the rest for the end.
Okay.
So a quick question here. What is the best settings to use for melasma, 515 versus 640?
I would use both, right? I would want to, I mean, you can only see the melasma of what you can see. Now, I will be very clear, dermal melasma, deep dermal melasma is really something that can only be targeted by a Q-switch laser. But deeper melasma, mixed melasma, you can get a lot of benefits by using that 640 filter to target what you can't see and then coming over top with the 515. So if you start seeing the redundancy in my treatment plan, with pigment, 640 toning, 515, 640 toning, 515. I just adjust my 515 parameters depending on where I am. They're gentler if I come off the face and way more aggressively if I am on the face. But this is this thing, you don't need 1,000 combos to do it. But those are the go-to filters for anything we're doing when it comes to pigment.
Okay, one more here, just in relation to what we talked about. You mentioned using the small square to go up by a couple of joules. When using the 515 single pulse, which is then 412, it won't let me go up more than 12 joules.
Well, I have the simulator right here. So why don't I bring this down and let's take a look. I have the screen. I'm going to go to 4 or 515. Let's go there. Let's go into our P1. I'm on a single pulse, 4 milliseconds, 12. It does go up by 2, but what it's going to do is it's going to monitor you. You can't stay at 4 milliseconds. So the machine goes, okay, if you're going to do that, I have to bring the milliseconds up a little bit because you're going in too aggressively, but you still need to have that energy go up. So, excuse me. When you start moving up, your milliseconds will change, but you're right. It will not allow you to stay at the 4. It will adjust up. So it's sort of going with you, going, if you're going to do that, I need to do this, but you're still going to you need that because you're using the little square. I hope that answers your good question. Thank you. Now, if you look at this lady, what we did, again, redundant, 640 toning, 515 single pulse. But if you notice here, a bruise developed. Can't see the vascularity really there, but it grabbed something. And the 515 definitely can do that because you're, again, being more superficial. It all resolved and went away. One of the things that I do when I do these treatments, I always say, I could bruise you. There's potential that I'm going to bruise you, like I hit you kind of bruise. if I tell them that, I don't surprise them when they sit up. And I think it's very important that we tell our patient, our client, these are the things that can happen. You're going to see the light reflected through your skin. I could bruise you. I'm going to light you up like the 4th of July. I'm going to make it look like you lost a wet coffee ground fight from me. But this way, they're prepared for what's going to happen. And the resolution of what she got, and she needs more treatments, but this is just one treatment, and we cleared a lot of it away. Two treatments here, 640, 515. One treatment, 640, 515. Some really nice treatment results. This was with the 515. I don't know here if Dr. Gandhi used the 640 in his place. Now people are going to go, well, do I need to do the 640? The 515 will do a good cleanup for you, but why not target what you can't see by going in and a toning pulse first? I'm not saying every treatment has to be 640, 515, 640, 515, but I am saying if you at least on the first couple target what you can't see, those results just start to look really outstanding in what you're doing. Here's another one from Dr. Gandhi. And as you could see, here would be an example of these lesions here might require more than what IPL can do and getting rid of them, right? Lots of cleanup here, but you got all different types of pigment on the face. You don't know until you start treating in some cases of what you're going to be able to clear. But this is a good example of different types of pigment that is sitting on her face. Now, with everything that we're doing with our IPL, with our 640, with our 515, lighting them up, all of that has to be protected in what we're doing. So I'm going to let SJ talk a little bit about this slide of what you can do, first of all, to maintain your results, right? Or starting with some of this to get better results.
Thanks, Teresa. Just before I review what's on this slide here, those that are asking questions, please keep putting them in the chat. We're going to hold the questions for now just so that Teresa can complete her webinar. So obviously on this slide here, we can see the Bella, we got some DP4, and we do have some color science there as well. So encouraging our clients to maintain skin health and really take an active role in their treatment journey, I'm sure we all know is completely essential. I always refer to this during the consultation as kind of that global synergistic approach. The patient and we're locking arms together to ensure we have those optimal results with their treatment plan. And in this case, combining IPL with targeted skincare and Bella MD treatments, and obviously non-negotiable sun protection will help us get our patients there. So here we have the Bella MD. I'm just going to go through this relatively quickly, but using the Be Even serum as your choice with the Bella, not only is it going to provide hydration, skin hydration is widely recognized as a benefit in the aesthetic procedures. Skin hydration tends to have better elasticity as well as a more uniform surface, which can ensure that consistent, even light distribution when we're using the IPL. But outside of that, in helping to repair skin barrier, outside of that, we have the Be Even, which has key ingredients that regulate the melanogenesis cascade right from activation. So we're targeting the cascade with this. We're also hydrating the skin and in turn enhancing the results from our IPL treatments. Obviously recommending a skincare protocols to your patients to complement the procedure that you're on should be non-negotiable from yourself, as well as providing them options of sun protection, color correction that is also going to help enhance their treatment results. So Color Science is a really great lineup of products designed for pigmentation, also addressing the melanogenesis cascade from activation, providing color protection, and obviously the SPF, which should be non-negotiable. So for me as a provider, education is key. And it's up to us to make sure that we guide and educate our patients on selecting the right skincare to have that global synergistic approach. Thanks, Teresa.
Thanks, SJ. So again, that's just to bring that point home. Your IPL does what it's supposed to do, but this is what enhances everything that you're doing. And we know across the board, if our skin is more hydrated, we get a better response for everything that we do. But this is also so important in that melasma thing. This is what's going to maintain what you've done with that one treatment of IPL before you're going to go back again by using these things to keep it as much as you can at bay, right? All right, let's move on to our vascular. So now, of course, we will be changing the filters that we're going to be using. So I want to show you the settings here again for the toning. When we go into toning, this is what's going to come in when you put in the 585 filter. Go to toning, put it down to 10, and do your toning passes. When you want to come over to your double with your 560, this is what comes up when you put in the 560. So you see here, I did not make any adjustment to what I usually tend to start with under this double pulse. If I wasn't seeing the reaction that I wanted to see, like red and reactive, and maybe, I don't want to bruise somebody too much, but I do need that reaction. I will put my fluence at sometimes to 18. And then once I bring that vascularity and start bringing it down, tend to move into that single pulse. You also have a V1 setting on here that does mild to severe of skin types 1 to 3 that you can also choose from. Those are great parameters, but this is a go-to parameter that you can use when you're treating for vascular. So here's just wanted to show, doing a treatment, the amount that I'm pressing when I'm doing it. This is what's great about this handpiece. I can use the trigger on it or I can use the foot pedal. I tend to be a foot pedal girl, so you can see why I'm holding it the way I'm holding it. And I come up right under the bottom eyelashes when I do it. But it's the pressure. I obviously press quite hard when I'm treating pigment. I don't press as hard when I'm treating vascular because I don't want to push out what I'm targeting, but I still do a nice pressure when I'm doing it. You compress those nerve endings. You're giving them the nice coldness of that sapphire. So it just makes it more comfortable when you're doing it. So started with the toning pulse with the 585 and then moved on to the double pulse with the 560, which here is going to be more spicy. It's just the toning pulse is just a nicer delivery to the skin, whereas the double pulse or single pulse, it's like a snap of an elastic band is the best way, I guess, to describe it. And when you're treating inner face, it's more sensitive than when you're on the outer face. So vascular conditions treatable with IPL. So I think this is where our next poll comes in. Vascular conditions. What is one question you could ask your client to help differentiate between rosacea and flushing? So we have rosacea and flushing is what we're dealing with when we're dealing with vascularities. What's one question that would help you differentiate? A, did it start with when you were a child? B, does it happen only when you get embarrassed? Or C, what are your triggers? And our poll, C. Did it come up, SJ?
Yep, I saw it there. I just didn't get to see the end result answers.
Oh, okay. Yeah, because it didn't come up on mine. Didn't get to see it. So rosacea is a chronic skin condition that primarily affects the face, causing redness, visible blood vessels, and sometimes pimples or bumps. It can flare up due to triggers such as spicy food, alcohol, or exercise. The exact cause is not fully understood, but genetic and environmental factors likely contribute. So if you guessed and said, Rose, like, what are your triggers as how you can maybe help which vascular you're treating, that was the correct answer. It was C. And flushing is a normal reaction to embarrassment, anger, and stress. Face can suddenly become hot and sensitive, often accompanied by sweating. But I get that a lot. How do I know? How do I know I'm dealing with rosacea? If you ask somebody, what are your triggers? And they look at you like that's the most confusing question, they don't really have rosacea, because people that have rosacea will very quickly say spicy food, red wine. When I work out, it looks like I'm having a heart attack. Now, this is in their genetic code and we can't take that away. What their parents gave them, there it is. Rosacea affects women more than it affects men. When men get it, it's usually more severe in the form of rhinophyma. They get the bigger noses with it. And everybody's can be different on what triggers it. So you're not making this go away. So you never want to do a consultation that's what's going to happen. You're there to control it, keep the inflammation down. In some cases, rosacea is painful for them. They find their skin hurts because of rosacea. So this is a wonderful treatment for breaking up that vascularity. I usually recommend you do 3 to 5 treatments. And then again, it will start to manifest. When will it manifest? Everybody's conditions, maybe they're going to see you in 4 months, maybe they're going to see you in 6 months, but they will know when it's time to come back to you. It's like they'll have that glass of wine and it looks like they've had 10. Time to go get your IPL treatment today. So this is one of the things that, again, when we get to the skincare, is so vital in helping this condition of rosacea. Flushing you can treat. You can do a series of treatments. People may not feel so much of that if they're telling a lie or whatever, but it's rosacea is just different. It's something that you have to continually treat for. So here's combination filter, 585, 560. Now we've switched over to the vascular. So 585 to go where we can't see in that iceberg effect, and the 560 in that double pulse is what we do and come over top. Another one, same thing. We're not changing it up. But these women, once they've had their series done, you'll be seeing them again. And the best part is they know when to come back, because they'll all of a sudden go, it's time. Beautiful results. And this is one treatment. One treatment. Or is this two? No, one treatment. Now, when we're dealing with rosacea, one of the other things we're looking at is telangiectatic vessels that all fill in there. So people go, well, what should I treat first? Should I go for that? Or should I treat more of the flushing, the redness overall? I tend to go more to get the redness down. I like to do that first, because anything that's hidden within that redness is now exposed, and I can go back in and I can treat. So people want to know what we can do to treat that. And this is where we are going to use the little square adapter. So when you look at this, the 12 by 12 square adapter, you see in here, I've put the 560 filter in. When the 560 filters in, this is what automatically comes up as a double pulse: 7 milliseconds, 20 millisecond delay, and 16 joules. Well, to get vessels, we have to be a little bit more aggressive. So I manipulate it. If you take a look at what I'm going to do here, and this is only done with the 12 by 12 square. I bring my delay down to 1, and I turn my energy up to 21, 22, still keeping the milliseconds at 7. By taking that delay down, I'm fooling it that it's almost in a single pulse. So it's giving me a more aggressive pulse to the tissue. I would never do this with the full sapphire. This is only done with the 12 by 12 square, and you do a max of 2 pulses only. If you can't make something go away after you've hit it twice, you have to leave it. It could have a feeder underneath. It's just not something that you can get. Now, I'm saying this with the 560 filter. You can also do this with the 585. The same numbers will come up. It'll say 7, 20, and 16. Adjust this down to 1, move this up to 21, 22. Where I would choose to use the 585 is on the cheeks. I need more depth of penetration, and the 585 gives me that. So that's just a little trick you can use when you're doing it. Why I don't do it in the single pulse, which I'm sure is the question that's going to be coming through, is I can't get my fluence up to 21 and be at 7 milliseconds. That's the combination I want when I'm doing it for best results. So if everyone was asking that question, I think we've answered it there. So then when you're doing the treatment, you put on the little square, a very little gel. And what I do is I take gel and I put it on my big sapphire, and then I put the little one, the 12 by 12 one on. Big sapphire comes through to the little one. Now, when it's hard on screen here to show that some of these vessels were just disappearing, but don't overtreat. Like I said, 2 pulses max. Review them in 3 to 4 weeks. See what you cleared up and could get nice results with it. But it's just targeting. Very little gel. Gel, if you put too much gel, that energy absorbs into the gel. I started in the day when we had the vasculate, and that IPL came into Canada in 1997. There was no cooling in the sapphire, and you would put this much gel on, you would hover in the gel, you would not touch the skin to treat, and it only fired every 8 seconds. So we have come a long way in IPL treatments. And then you can get results like this. So by using that setting with the little square, you can do some really nice cleanup with some of the telangiectatic vessels that are around the nose and on the cheeks. I like showing this picture because I think I was surprised at the results of this picture. One of the things that Dr. Gandhi in Ohio, he was so excited about with this system is that we had a 585 filter. He's like, that's a pulse dye. That's a pulse dye wavelength. We need to take it for a spin. And one day I had a tech, Ashley, reach out and go, I want to treat this poor one. I said, you need more than that. I don't know if it'll make a difference. And she's like, well, she doesn't care. She just wants to try. So we did 585 and 560. And this is the result that we got. Now, the 585 here was not used in toning pulse. It was used at 6 milliseconds and 14 joules. So it was changed more into a single pulse to mimic more of what we could maybe get with a pulse dye. But I thought these results were surprising to me, because I always say we need lots of technologies to treat a port wine, but this did pretty good. And of course, you can't treat a skin condition like rosacea and just use IPL and think that's going to solve everything. And a lot of times when you come with someone comes to you with rosacea, they tell you, I just use water on my face because everything I use reacts. So SJ, tell them what they could do for the rosacea patients.
For sure. It's definitely a delicate balance of using ingredients that are calming and anti-inflammatory. Definitely considering working on strengthening their barrier function, which will help to also reduce the vascular visibility. So treating and targeting the skin for as I said, barrier function and hydration, but also providing ingredients that, again, meet the rosacea where it is, meaning let's meet it at its triggers. What is causing this redness to come up? So again, targeting the vascular cascade. So we talked about the melanogenesis cascade, meeting it right from inflammation. It's the same concept with when you're treating rosacea or vascularity. Color Science has an incredible all-calm lineup specifically designed for vascular rosacea patients, providing ingredients to target that inflammatory cascade, but also offer color correction. And then obviously sun protection should be non-negotiable for all our clients. And using the Bella with the Be Calm, it has an incredible ingredient in there that really targets that skin barrier function. And then obviously you have hydrogen water as an option as well to target and treat anti-inflammatory, soothing, calming, and providing antioxidant support as well.
Wonderful. Thank you. That's one of the things that we definitely know is, you know, a lot of times with rosacea, they're not wearing makeup, that it's a reaction. If you choose pure minerals and stuff, they sit on the skin. They don't absorb into the skin, right? They sit and they don't interact with rosacea in a negative way. So this is really important. They also have a product called All Calm, which is not only helped cover it and camouflage it a bit, but is actually used for the treatment of rosacea. So again, it just can't be IPL on its own. You always want to put something else in place with that. Any questions there, SJ, for us on vascular, or can we move on to our last and final?
I think let's move on to the last, just being mindful of time, and then we can answer those questions. And just for everybody, there will be a recording that will be sent out in a few days just following the presentation, along with a copy of the slides, as well as the Darwin Parameter book.
Well, the thing we want to tackle here is obviously acne. This is something you can use for the treatment of acne. Sebaceous glands don't like heat. It's as simple as that. You go and put heat into the tissue and go after the sebaceous gland, it's going to retreat. It's going to be less active. And then, of course, you have that amazing 430 filter that targets acne bacteria. So you can do those combos for the treatment of acne. You can target the inflammation, you can target the papules, but the bacteria is just that added bonus to be able to do that. When you're treating this, a lot of times you're treating people, they're already taking something internally. One of the things that we for sure do not recommend is that if you're taking Accutane, you don't do IPL treatments. Now, saying that, I'm saying that as a clinical trainer. If a physician says, I feel it is safe, I microdose with Accutane, I want to do IPL, again, we would, make it very clear that that's a physician's choice if they want to go ahead and add on treatments. If you're taking photosensitive acne medication, it's not that I won't treat you, but there I would treat you a skin type higher. I would want to go in more gently because I don't know how you're going to react to my light, but I wouldn't totally take it off the table that I wouldn't treat you with IPL if you're on a photosensitive medication. I would just start gentler, like treating a skin type higher when doing it. So when you're looking at these treatments, again, just bringing, this is acne rosacea, bringing that down more. I mean, this is one treatment, but you can see here already what it's done for the inflammation and the redness of covering. And now she can cover this with her minerals better as well. But that raw look starts to disappear when you do stuff like this. So you get some really nice results with it. So what here we have in our Darwin book is, well, what would I choose? We say 640 filter for cystic acne, 585 filter for inflammation, mild to moderate, and then the 560 is for very mild. So you could do your toning, and I would do these all in toning. I would do 640, you could do 585, or you could do 3 of the 640, putting that heat down to that sebaceous gland. But when you come with the 430 filter, it's one pass. And I tend to use the 430 in toning. It's more of a spicy filter because you're so superficial. So in toning, we're using the 430, safer too, because you're more superficial. So I tend to be in toning mode for most all acne that I'm treating. But you can see it says a double or a triple pulse, but toning just is a really nice way to treat it. And this isn't every 3 weeks. You can do this weekly, bi-weekly, 6 to 8 treatments to start. But remember, first thing you're going to do is you're going to cause disruption. You're putting energy in so they could purge, they could feel dry, all of those things. You're going to switch their product, because if they're using, stuff that you don't feel is designed for their acne condition, that's one thing you're going to want to switch out. So by switching their products, their pH changes of their skin, they could have a problem with that too and cause more of a breakout. So you need to really be confident with them that please give me 3 months to make these changes for you, and be expected that there's going to be some breakout, but these are good things. This is how we're going to start resolving the issue. So again, this is another condition that can't be done with, okay, I have an IPL, and go slap CoverGirl on your face and don't do anything right for your skin for skincare. Then it's not going to be successful. This is a trifecta. This is triage, right? You're going to do 3 things. My IPL is just one treatment umbrella. So again, there's treatments for acne, and I'm going to let SJ just, finish this up into a bow for us of what you can do for that.
Yeah, totally agree with Teresa there that acne is absolutely a complex skin condition that we could talk about and have a whole webinar just around acne. And IPL is one of the powerful tools that we have in treating acne, but there are a lot of other combination treatments we can do, as well as obviously offering patients the proper skincare to help with their acne, offering them mineral-based products to help camouflage and correct while also treating the skin. And this skin health condition really does require that comprehensive global synergistic approach. We know that acne skins, most times patients are coming in with severe dehydration, and that's going to lead to increased inflammation and sensitivity post an IPL treatment. So if we can work on skin barrier, if we can provide ingredients and products that the patients can use at home as that global synergistic approach, we can obviously lead to a better treatment outcome, whether that's using IPL or really any other treatment offering that you are doing when you're targeting acne. So with Bella specifically, Be Calm and Be Clear are both really great treatment options. Be Calm to target your barrier function and dehydration, and your Be Clear with salicylic acid to target and treat the inflammatory breakouts there as well.
Wonderful. Yeah, you have to have products. One of the things on the Darwin system as well is we have RFM, microneedling, with non-insulated needles. And one of the things with that is that those needles don't deliver energy until they're into the tissue. You won't spread the acne bacteria, but it is a great combo that you could treat with that as well, get down deeper into the source with that microneedling, and then still come over top with your 430 filter to target the bacteria. So there's many different combos that can be done with the entire Darwin system of treating all these different skin conditions. So I think that brings us to the end of our presentation of, how you can use your Lucent IPL. And we'll just go over if there's any questions that we have not quite answered that we still need to answer. We'll finish with that. SJ, is there more, or where are we at?
Yeah, no, we have quite a few more questions to go through. So we understand if some of you have to jump off just based on time. Again, a recording will be sent out to you. So we'll go through each of these questions from the top. First one, how many filters can be used in one session?
Well, you've got to look at what condition you're doing. So on the top of my head, I would right away start with, I would think 4. Like, let's say I was treating someone that had redness and had sun damage. So, on the sides of the face, let's say there's sun damages in here, I could come in with the 640 and then 515. So 640 toning, 515 P1 setting. And then in here, if they're red, if they had the rosacea through here, I could do 585 toning with the 560 double pulse. So I could do 4 filters at one time. I wouldn't all over the same area. I tend to break it up in the condition that I'm going after.
Excellent, thank you. How many sessions does it generally take to treat rosacea? I find 3 sometimes doesn't really work.
3 to 5. It really, the vascular is going to fight harder. So it can be up to 5. So, you set that expectation for your patient, your client, saying, 3 for sure, but we might need 5 to get where we want to be. And again, applying the skincare and all of that as well with that to help those results along. But rosacea is tough.
For sure. Next question, can broken capillaries fully disappear with IPL, or they just get less noticeable?
Get rid of them. I mean, the really small ones you can go after, but some of them, again, it's what's going on underneath. We're such a vascular system under there. You know, if I'm choosing to treat veins and stuff, and one is stubborn and I just can't get it, laser might have to be called into play for something like that, more depth of penetration to get it. But those superficial ones, you can be pretty successful. But if you're treating rosacea, along with that comes that vascularity as well. So it's like the body's always recreating it, right? So all you can do is target. But in some cases, if you have lasers in your practice, that might be a better solution. We just made one here for you if you have an IPL that it can be very successful in a treatment.
Yes, it can. So if you were to do the combo treatments we spoke about, how many passes of each wavelength can you or should you do?
Well, the toning, I mean, it's one, right? But if you, let's say that's all you were going to do is toning, you weren't going to do something more aggressive over top of that toning. I could do a 640 toning. I could do a 585 toning. I could combine that together. But I look at that more as my follow-up treatments, my maintenance treatments for you, that I would do more something like that. Toning followed by a single or a double pulse on top of it, as they are, will always give you those really amazing results. Where I tend to not even do a lot of toning is if I'm treating hands. Hands, I tend to just go in with, I'm going to go in with my 515, my P2 setting, a spot treat if I need to. But for the face, that toning is where I do that, and then my single or double.
Thank you. And then just to follow on with your P settings you were talking about, can we use P2 settings that are programmed into the machine, or are those not as effective as the settings in the parameter book?
Well, in the parameter book that you have, that you've gotten from this webinar, it will say P1 and P2, and that's for skin types 1 and 2, right? Skin type 3, then you use what's in the book. But you know how we talked at the beginning about a skin type 2 becomes a 3? Well, a skin type 3 can become a 2 if they have had no sun, no exposure. You know, you're hitting February, and if you, wherever you are in the world, if you're going through winter, it's minus 30 where I am right now. I'm not sunning myself outside. So that melanocyte goes back, that I can use it even on a skin type 3 when I'm using it. But no, the P1, P2 is really specifically designed for that light skin because they are more aggressive.
And just to summarize that, the P2 settings that are in the parameter book are the same parameters that are found on the system.
Yes.
Next question, when layering multiple wavelengths, would you consider lowering the fluence to minimize bulk heating?
Well, that's the wonderful thing about the toning, right? It suppresses heat. So that's why we can do that. I can't do that with other IPLs because I don't have that toning pulse. So you don't have to worry that that toning pulse is going to affect what you decide to do with a single and a double pulse, because it's suppressing that heat, creating that collagen bed underneath. So that's the one good thing that we can do with this IPL.
Love that toning pulse. Okay, so I know the 515 is not safe for skin type 4. Is it safe if used with in the toning mode?
Yes, I have seen people use the 515 in the toning mode. Scared me when I watched it, but what I noticed when it was being used is that they sort of lit up slower. Like, you know how you want that darker pigment to come forward, but in a gentler way. It was a delayed thing. It was almost like you were 5 minutes after the treatment that you saw it come forward. And it is incredible, and people are using it for that. So you can use it in toning mode, but you know what, please go slow and steady with it. Don't just start snapping away at it. You know, do a few pulses, see how the skin is reacting when you do something like that.
There was a question here that says, what size crystal was used on this patient? I'm assuming it was the large crystal.
Yeah, I
I don't know
always
which
use the
patient that
large
was.
sapphire. It's always that. That's what I'm using. I only use the square adapter, the 12 by 12, if I need it in certain areas, because I want the energy and I want my parameters to be exactly where they are. And the minute I put that little 12 by 12 on, my parameters are not what they are. I have to adjust accordingly.
Mhm. When you do the 640 and the 515 for pigments and melasma, oh, sorry, questions are coming in, so it's jumping around. Do you do one layer of 640 and 2 layers of 515?
No, I wouldn't do 2 layers. When you do that P1 setting, if you're going to use that, um, at 12 and 4 milliseconds, one pass will do what you need it to do. But do the 640 first, do that toning, then come in and do the one pass. It's not that I wouldn't put my adapter on if I felt I needed to do more, but you're going to get a pretty good response from using that P1 setting.
Hmm. And for hyperpigmentation, do you always use the 640 at toning? And what is the best pulse structure for the 515? Single, double, or triple?
I tend to I'm going to admit that I don't use 515 in anything but a single pulse, because it is my tool to break down that pigment, and pigment needs and responds so well to a single pulse. I think if I was going to target someone's pigment and they had a lot of vascularity in it, maybe then I would go to a double pulse. But it just, in all my years of doing IPL, it's in a single. But let's talk about that for a minute. If I was treating somebody on their neck and they had a mix of browns and reds, I'm going to start with the brown settings, because in these filters, I have red sitting in there. If I put the 515, 560 is in play. These are cutoff filters. If I put the 560 in, 515 is gone. I don't have the 515 working for me. But if I do 515, 560 is a little bit in play, not as strong as it would be if I put the actual 560. So if someone had a mix of polydermin here, browns and reds, 640 toning, 515 P2 setting, because I want to be down at 10 joules. Next time they come, I go, okay, boy, I got rid of a lot of that pigment. I still see some vascularity. Now I would switch to my 585 toning, and my 560, I would do a double pulse. And when that comes up at 16 joules, I would drop it to 13 if I was treating neck and chest. The only settings we put in there is that P1 and P2 as facial settings. All the other settings with your other filters are facial settings. Drop by 2 to 3 joules if you're going to take it off the face, because this is not as forgiving as this.
Excellent, thank you. Okay, so is toning 1 or 2 passes?
If you're going to just do toning, like if you wanted to do a 640 toning and a 585 toning, I don't see why you couldn't do that. But then I would probably be coming in more, well, no, I'd do a single or a double as well. It depended. I would do double if it was vascular, and I would still do single if it was pigment. But it's just, again, looking at why would I choose that. 640 is targeting my pigment, 585 is targeting my vascular. If they're not vascular, again, I would just do more 640, 515.
Can we treat broken capillaries on the lips?
You'll bruise them probably. This is very vascular, that area, but I mean, you could try. And if you do cause anything, lips are really, really forgiving and resolve quickly. But you could try it for sure.
Okay, so here's the next one. Thank you. So why are you using 515 for pigment when oxyhemoglobin is primarily absorbed in the 5 to 600 nanometer band of light? Yes, pigment is absorbed in that range of light, but secondary, whereas blood is preferential. Prefers to be absorbed.
Yeah, no, 560 treats pigment as well, but 515 will treat even more epidermal. And even the 430 on top of that, I've come over top of that to hit pigment. 560 is always been used for a lot of times for pigment. People are afraid of the 515 because they don't know how to use it. but you need that superficial 515 filter to target that. 560 is in play. So my question back would be, well, why would I just do the 560 and cut out my 515? Why not have that 515 in so my 560 can also do a bit of the job, and then move to my 560 if I want it? But that's how I look at it when I do it, is I'm cutting one out with it. And 560, yeah, it'll target a little bit deeper pigment, but that very superficial, my 515 is my gold standard for that.
Yeah, and I think the key thing is those cutoff filters, that with the 515, the
Absolutely.
560 is still in play.
Yeah, yeah.
I usually treat clients at a single pulse only. I found the results to be amazing. And sorry, I usually treat clients with a single pulse only, and I found the results to be amazing. Am I doing it
Wonderful.
wrong?
No, you do. The only thing I always say in a single pulse is if you're treating vascular, I mean, there just could be more examples of bruising. But if you're prepping your client patient for, I'm going to bruise you like I took you behind a building and beat you up kind of bruising, and in 7 to 10 days, that bruising goes away, and what I was targeting will also be gone. Absolutely. It's just, you tend to go a little bit in slower with anything that's vascular in that double pulse. The toning is there, just again, it's that iceberg effect. Target what you can't see. You're bookending the problem. You're going underneath and then you're coming over on top. You don't have to do toning every time. There's just such a benefit to it. That's I guess what my point is.
And if you're getting amazing results, I'd say you're doing it right.
Absolutely.
When treating flushing, does the condition need to be present to treat?
Oh, that's a good question. I don't know. That's a good, I don't know the answer to that. But you know what? We'll get you the answer. I know a guy that would be able to tell me that pretty quickly. So we're going to find out for you and get back to you. It means that what they have to be in front of you. And you say, gotta tell me a lie. Gotta see the flushing come. Very good question. And we will definitely get back to you on that one.
When they come back for a touch-up, is it just one session they need, or do you recommend doing the 560 first or the 585 when treating? Does it matter what order you use your filters?
You always want to go deep before you go superficial. So 585 would come before a 560, right? 640, 515 kind of thing. So always go wherever you're going to go down deep, do that one first and then come more superficial.
Excellent. For rosacea, would a combination of IPL and 1064 long pulse laser be an effective combination treatment? If so, would you alternate or finish the series independently?
Well, it depends on what 1064, like, are you doing it in a painting mode? Are you using frac 3 or are you using versa? Like, I sort of would need to know what you're doing with a 1064, but I'll tell you how I do it because I have a 1064. I might do 2 treatments with 1064 just to target down really deep, which is where that 1064 goes, and then do 585, 560 on the subsequent treatments and get a better result because I've already gotten rid of a lot of target really deep down.
Is there any talk about getting a vascular filter like the M22 has?
No, I don't hear any talk about it, but with this one, again, with what we're doing with the 560 and putting it into that treatment of shrinking that delay, we're seeing pretty good results.
How close to the eye can you go?
Right up under the eyelash. I go right up. I come right up to here. But I mean, of course, when I get here, I tell them this will be very bright when I'm up at this level. But I try to get, if you miss this on me, I'm 56 years old. I want this treated. So you got to get right in there to treat that.
Would you use the same vascular settings for the cherry angioma?
Yes, I would. That one that I told you with the 12 by 12, I absolutely would. You might have to give it 2 hits. Your goal for that when you're hitting cherries is you want it to go black, right? And then they just fall off and they go away. So you can, but again, if you have the ND egg, that's a more focused. Like you want to look at IPL as sort of like rifle fire, and lasers is like sniper fire. So, just gets the job done. It's more focused in on it. So that's just an example. But yeah, you absolutely can.
Okay, sorry. There is, instead of changing the delay for one tone pulse, could we not just choose the one pulse setting on the right and add 2 additional joules?
Say that again. Okay, what was that? I mean, I have to put that in here. What did she say?
Instead of changing the delay from one tone pulse,
Mm-hmm.
could we not just choose the one pulse setting on the right and add 2 additional joules?
I don't understand that. I don't understand what I'm being asked. So is she talking with the 560?
I'm not sure. We can get back to her independently just to
Yeah, we'll
clarify
have
the
to, 'cause
question.
I would have to, yeah, I don't quite understand the question.
No problem. Okay, so why do you divide the filters into pigment and vascular ones? If we look at the absorption spectrum of different wavelengths by chromophores, we will see that the 515, 560, and 585, both melanin and hemoglobin, are absorbed very actively, and at certain points their absorption levels will be similar. This means that these filters in IPL systems do not have selectively based on, filters in the IPL system do not have selectively based on the chromophore. Why separate them?
Because they're filters that treat at different depths. Remember, the filters, the higher the number, the deeper you penetrate into the skin. So you're treating what you can't see, right? So you're using all the tools you have in those filters to treat different depths. Superficial pigment, if you're looking on the absorption spectrum, sits very close to the surface, the top of the skin, and the vascular starts coming down. It's known that the 560 is one of the gold standards for treating vascular. So if you're looking at that and where pigment sits, you're going to use all different wavelengths to target. Who says it just sits at that one depth in there, right? So you need those deeper filters and more superficial to put that combination together to target everything you want to go after.
Thank you. Can we treat spider veins on the legs with the vascular settings?
No. No, spider veins on the legs. I personally, if someone out there is doing it and you feel you're having success, well, then good for you. I'm not here to tell you what you can't do. Me personally, as a trainer, we do not train on that. Leg veins are deeper than we think that they are, and I have seen some adverse events of people pulsing and then causing problems with that. There tends to be reticular that goes along with those spider veins that are feeding them, and you need to target that. So in those cases, I tend to like a laser to treat leg veins.
Thank you. What is the difference between BBL and IPL?
BBL and IPL are the same thing. BBL just means broadband light. So they just named it BBL, but everything with the BBL is a single pulse. I don't have the ability to move it into a double or a triple or a toning. Everything is in a single pulse. And I'm not saying that that's a bad thing, but if you want to know the differences, everything is the single pulse. They use temperature adjustments as well for their treatment delivery with their parameters, but everything there is done in a single pulse. So I'm sort of stuck as that one short order cook and don't have, all these different pulse things that I can do to be a chef.
Excellent. What about skin type 4? There's kind of 2 questions here I'm going to ask that came back to back. Skin type 4 with acne concerns, but 430 cannot be used, and a 430 filter on skin type 5 for cystic acne. Question.
Yeah, no, you can't. So again, it just comes down to you can't. Proper skincare is important. I mean, you could use, like, again, the 430's out. It's not that you can't with the skin type 4. You can do your 640. You can put energy down there. Absolutely, you can. And with the 585, you could layer it up, but you can't come over top with 430 on the surface. So, and then again, proper skincare that goes with it. If you have laser, if you have that too, that you can put heat into the system, you could do it that way. But no, skin type 5, no, absolutely not. And 6, no.
Exactly. Do you have the round 8 by 8 millimeter adapter? Isn't that better than the square one?
We in Canada have stopped with the round one. The square one is the one we tend to use more because it is a little larger. And remember, the smaller I keep getting, my energy has to be adjusted accordingly. So the square just tends to be one that we find is more effective. It's not saying that the round one isn't effective, that you can't use it, but you might even have to adjust a couple more joules because it is smaller. So just be aware of that.
Is it okay to treat the neck with the IPL, or could that have an impact on the thyroid gland?
No, you can treat the neck. Absolutely. Treat all the way down to the chest, right? You're good.
Is it okay to put a cooling sheet mask after a treatment for rosacea to cool the skin down, or will it take away from the treatment?
No, absolutely. You could put something. That's a great post care to put something like that on. Absolutely. One of the things is that I find some people do is they want to take a hot towel and wipe the face before they begin the treatment. And I wouldn't start with putting a lot of heat or any type of heat in the skin before I begin my IPL. But after treatment, you want to do anything cooling like that. That's amazing. That's great.
Do you use the 12 by 12s for the cherry angioma?
Yes.
And what were the settings for the port wine stain?
It was a single pulse 6 and 14 with the 585, and then a double pulse with the 560, just at the setting at 60.
Okay, and do you see any benefit of keratosis pilaris on the face? What settings would you recommend?
Well, keratosis pilaris is, I've
Rubra.
seen, is that what they're calling it on the
Mm-hmm.
face, they're
Mm-hmm.
saying?
So do
Well,
you
I
see any
think it,
benefit of keratosis pilaris rubra?
I mean, heat. I mean, to me, that's something I always see on the back of the arms. That's if I'm correct on what you're asking me, and that's just little hairs that won't come through the surface. So if you treat that, you can open that up. I would need to look up what that is because I think that's it. If that's what I think what it is that's little bumps on the back of the arm.
Sorry, I was on mute. Do you find it more beneficial to treat brown first in one treatment and then red in the second treatment, or using a 560 or 585 better?
Well, see, there comes back to that question, right? Like if I have browns and reds, I'm going to start with my browns because my 560's in play, my 585's in play. So I'm always going to do the browns first because my reds come along for the ride. I still have those wavelengths in play.
Excellent, thank you. And does the vessel setting work for vessels on the leg?
No, we don't treat leg veins.
Uh, could the Bella MD men's handpiece or electroporation handpiece hurt melasma or rosacea? The answer is no. I think with the rosacea patient, just kind of, you'd have to assess the patient. Sometimes they're significantly uncomfortable, depending how bad their rosacea is. You may want to just stick to hydrogen water and the Be Calm infusion, even avoiding the dry microdermabrasion as well. I think we're coming to the end. I'm just going to check through the last here. What's your 640 toning pulse setting again?
640 toning, I bring you'll have it at, it'll come on when you put it in at 15. When you put it on toning, move that down to 10, and then it's 10 and 9.
Okay, and our last question. I know you like the combo, so I'm sorry if this has been repetitive, but I want to make sure I understand. If they have a lot of red, 585 in toning, how do I choose the settings? And then a 560 single pulse?
It depending on how much red. If it's very little red, yes, you can do a single pulse. But the toning, yes, 585 toning, and just follow the parameters that are in the book under the skin type for the toning, and then do you could do a 585 double pulse, you could do a 585 single pulse, following all that depending on how aggressive you want to be, which a single will be more aggressive than a double. A lot of times, if you find them really vascular, you want to bring that red down first. And by doing that, you would start with that toning double and then toning single.
I lied. There's 2 more questions.
Okay,
How many passes with the 755 for laser hair removal?
one. One, and you just adjust according to, you want the smell of success. You want to smell that sulfur smell when you're doing it. And a little perifollicular edema and erythema, but it's one.
And last question, can you explain the difference between IPL versus laser treatment? It doesn't
Well, it's again,
specify which condition.
IPL is like, again, the best way, I mean, I don't like to use this as an example. If IPL is like a rifle shot, it's everywhere, right? Oh, I'm treating browns, but look at that red, or I'm treating red, there's that brown there. It's a little bit scattered and unfocused, right? It's incoherent. Lasers are coherent, they're focused, they're one phase. So if I'm using a 1064 laser, it doesn't go to 1065 and it doesn't go to 1063. It's 1064. This is what I'm going to target. This is what I'm designed to target. Whereas when you're using filters, you put in the 515, you have a spectrum up to 980. Okay, all the way up. If I put in the 560, 515's gone, it goes up to that. So all those filters are sitting in there. Wavelengths are sitting there, not as strong as what you put in the handpiece, but they're there. So not as focused as a laser. So a laser would just win the race. For example, let's say we were going to do IPL for hair removal, or we're going to do laser for hair removal. Both are effective, both are successful, both will permanently reduce hair. But usually a laser finishes the race maybe a couple treatments before the IPL does. But again, both great.
That's a great analogy. And that brings us to the end of the questions. Great presentation, Teresa. Thank you so much for your
Well,
time and
thank
lots
you
of
for
great
helping me,
information.
Sarah Jane.
You're welcome.
Well, thank you everybody for joining. Again, this will be, this is recorded and sent out to you. So thank you for spending your afternoon with us, and have a great day.